Can you imagine waking up to screams echoing through wooden corridors, the metallic stench of blood mixing with salt water, and the sight of a ship's surgeon holding a rusty saw above a sailor's shattered leg? Picture yourself trapped on a floating hell where infection spread faster than wildfire, and medical treatment was often worse than the injury itself. If you think modern medicine is scary, wait until you discover the brutal reality of treating wounded sailors during the colonial maritime era. And make sure to hit that like button, because this journey into nautical horror will change how you see those glorious age of exploration tales forever. Notice how the cramped quarters below deck created the perfect breeding ground for medical nightmares. The ship's surgeon, often a barber or butcher by trade, operated in spaces no bigger than a closet. Candlelight flickered against blood-stained wooden walls, while the constant rocking motion made precise cuts nearly impossible. According to Portuguese maritime records from 1580, over 60% of surgical procedures performed at sea resulted in death within a week. The tools clinked together in makeshift medical chests like instruments of torture, and the screaming never stopped. Feel the terror that gripped sailors when they heard the dreaded call for the ship's doctor. These men had no formal medical training, learning their craft through trial and error on living bodies. They carried bone saws designed for carpentry, needles meant for sail-making, and bottles of rum that served as both anesthetic and antiseptic. The wooden operating table, usually just planks laid across barrels, absorbed blood and bodily fluids that would never fully wash out. Each procedure left permanent stains that told stories of agony. The stench alone could make grown men faint. Listen to the chilling accounts of amputation procedures performed without proper anesthesia. Sailors were given a leather strap to bite down on and a shot of whatever alcohol was available. The ship's carpenter often assisted, using his woodworking tools to cut through bone while the patient's screams mixed with the creaking of the vessel. Spanish naval documents from 1623 record that amputations had a survival rate of only 15% when performed more than 2 days after. Injury. The saw blade, dulled from cutting wood, would tear rather than slice through flesh. Blood pooled on the deck below like spilled wine. Imagine the horror of witnessing gangrene spread through a sailor's body like black fingers reaching toward his heart. The putrid smell of rotting flesh filled the confined spaces, making everyone nauseous. Ship surgeons believed that cutting away diseased tissue with red-hot iron would stop the spread, but this medieval practice often caused more damage than healing. Dutch maritime logs from 1645 show that 80% of gangrene cases ended in death, with patients suffering for weeks before finally succumbing. The tapido, infected limbs turned colors that shouldn't exist in nature. The dying begged for release that rarely came. Contemplate the primitive understanding of infection that plagued these floating hospitals. Surgeons reused the same instruments on multiple patients without any form of sterilization, spreading disease from one victim to another. They packed wounds with whatever fabric was available, often dirty rags or pieces of sail, believing that keeping air out would promote healing. English naval records from 1678 indicate that over 70% of sword wounds became infected due to contaminated treatment methods. Pus and blood oozed from bandages like toxic honey. Death stalked the sick bay like a patient predator. Visualize the terrifying practice of cupping used to treat internal injuries. Surgeons would heat glass cups with candles and place them on the patient's skin, creating suction that was supposed to draw out bad blood. The procedure left circular burns and often caused additional infections. When the glass inevitably shattered from the ship's movement, sharp fragments would embed in already traumatized flesh. French expedition reports from 1692 mention cupping sessions that lasted hours, leaving patients looking like they'd been mauled by some sea creature. The suction sounds were like death itself drawing breath. Even the cure had become a curse. Observe the shocking reality of treating scurvy, the sailor's plague that killed more men than storms and battles combined. Ship surgeons had no understanding that the disease was caused by vitamin C deficiency, instead believing it was caused by corrupted air or moral weakness. They prescribed bloodletting, mercury treatments, and force-feeding patients spoiled meat. Portuguese health records from 1701 show that traditional scurvy treatments actually accelerated death in 90% of cases. Sailors' gums would bleed so profusely that their teeth fell out into their own gore. The treatment. Rooms reeked of approaching death. Recognize how the constant motion of ships turned simple medical procedures into acts of butchery. Suturing wounds became nearly impossible as the vessel pitched and rolled, causing needles to tear through flesh like fishing hooks. Surgeons often had to tie patients down to prevent them from being thrown around during operations, but the restraints often cut off circulation and caused additional injuries. Italian naval chronicles from 1715 record that 40% of surgical complications were directly caused by the ship's movement rather than the original injury. The constant swaying created a rhythm of suffering. Each wave brought fresh agony to the wounded. If you're finding these historical medical horrors as shocking as I am, make sure to share this video with anyone who complains about modern healthcare. They need to see just how good we have it today. And don't forget to subscribe because we're diving even deeper into the dark side of maritime history that textbooks never tell you about. Perceive the absolute terror of dental procedures performed by ship surgeons with no dental training. Toothaches were treated by yanking out teeth with blacksmith pliers, often taking chunks of jawbone with them. There was no understanding of infection control, so the same bloody tools were used on multiple patients. Russian naval archives from 1728 document cases where botched tooth extractions led to facial paralysis and eventual death from infection. The screams during these procedures could be heard above the howling wind. Many sailors preferred to suffer in silence rather than seek help. Recall the nightmare of treating burns from cannon fire and kitchen accidents on wooden ships. Surgeons applied heated oils and animal fat to severe burns, believing this would cook the flesh back to health. This practice actually increased tissue damage and created breeding grounds for deadly infections. The smell of burned flesh mixed with rancid oils created an atmosphere of pure horror in the medical quarters. Danish maritime records from 1734 show that burn victims treated with hot oil had a 95% mortality rate. The sizzling sound haunted survivors' dreams for years. Pain became a living thing that never died. Understand the primitive surgical techniques used to remove musket balls and shrapnel from wounded sailors. Surgeons would probe wounds with dirty fingers and unsterilized instruments, often pushing debris deeper into the body while searching for foreign objects. They had no concept of internal bleeding or organ damage, frequently causing fatal injuries while attempting to help. Swedish naval documents from 1742 reveal that bullet removal procedures had a success rate of less than 10%. The metallic taste of blood filled the air as patients slowly bled to death. Each attempt at healing brought sailors closer to their graves. Analyze the horrifying practice of treating fractures with primitive splints and bindings. Surgeons would set broken bones without x-rays or proper alignment, often causing permanent deformity and chronic pain. They used wooden boards from the ship's structure as splints, binding them with rope or strips of sail that would tighten as they got wet. Norwegian expedition reports from 1751 document cases where improper splinting cut off blood flow, leading to amputation of previously treatable injuries. The grinding sound of bone against wood echoed through the medical quarters. Healing had become indistinguishable from torture. Confront the terrifying reality of mental health treatment for sailors driven mad by pain and trauma. Ship surgeons believed insanity was caused by vapors or demonic possession, treating it with more bloodletting and physical restraints. They would chain mentally disturbed patients in the darkest parts of the ship, leaving them to suffer alone with their demons. British Admiralty records from 1763 show that over 50% of sailors exhibiting signs of mental distress died in chains rather than receiving any meaningful help. Their cries mixed with the creaking timbers like ghostly warnings. The mind had become another casualty of the sea. Discover the shocking truth about how these maritime medical horrors shaped the development of modern naval medicine. The thousands of sailors who died from preventable infections and botched procedures weren't just statistics. They were human beings whose suffering eventually led to the medical advances we take for granted today. The lessons learned from their agony, written in blood and documented in ship logs across multiple nations, slowly transformed maritime medicine from medieval butchery into something resembling actual healthcare. Every antiseptic, every proper surgical technique, every medical protocol used on modern ships can trace its origins back to the deaths of countless sailors who served as unwilling test subjects. Their screams still echo across the centuries, reminding us of the price of progress. Conclude by realizing that the next time you complain about a hospital stay or medical procedure, remember the sailors who faced rusty saws and dirty rags instead of sterile instruments and trained doctors. Their courage in the face of unimaginable medical nightmares helped build the world we know today, and their stories deserve to be remembered, not just as historical curiosities, but as testaments to human endurance in the face of suffering that defies description. Comment below with which of these medical horrors shocked you the most, and remember that understanding our past helps us appreciate our present while preparing for our future. Don't forget to watch the video and playlist that will appear on your screen.